What is scoliosis, the ultimate resource? Scoliosis is a structural spinal condition that involves loss of the spine's healthy alignment and normally leading to curvatures that are occurring from the front of the spine. Scoliosis can affect all ages, but it's most commonly diagnosed in adolescents and most commonly diagnosed as adolescent idiopathic scoliosis, or for short, AIS. Scoliosis is diagnosed when there's an unnatural sideways bending curvature that has developed and also has rotated into the concavity. This makes scoliosis truly a three-dimensional condition. The size of the unnatural spinal curvature needs to be a minimum of 10 degrees or greater, and this is determined by a patient's Cobb Angle. A Cobb angle is a measurement attained during a spinal x-ray. This involves drawing lines from the topmost tilted vertebra to the bottommost tilted vertebra in the curve in question. And then the curve is measured in an angle which is expressed in degrees. The higher the patient's Cobb angle, the more severe the scoliosis is. Scoliosis, unfortunately, can range in severity from mild to moderate to severe to very severe. Mild curvatures are curvatures that are less than 25 degrees. Between 25 and 40 is considered a moderate scoliosis. Once you break 40 degrees, now you're in the severe classification. And unfortunately, curves over 80 degrees are considered very severe. And we know scoliosis is a progressive condition and is in its very nature to worsen over time. So where a scoliosis is at diagnosis, meaning at mild, doesn't mean it's going to stay mild. And sometimes the word mild could be deceiving because when you hear the word mild scoliosis, you think it's a mild problem. But unfortunately, it has a risk of progressing during growth stages to become moderate, severe, or very severe. So where it's diagnosed doesn't necessarily mean it's where it's going to stay. When scoliosis worsens, it means that the size of the unnatural curvature is increasing, the rotation is increasing, thus the effects the scoliosis is having on the body is also increasing. And the effects could be very wide range depending on the patient, the age, and where they are within their growth cycle. As the spine becomes larger, the curve becomes larger, the scoliosis becomes increasingly more rigid. And as curves become more rigid, they become less responsive to any type of treatment. Therefore, treating curves before progressive states and before it becomes rigid should be the goal of majority of treatment. Now, when we look at the main effect of scoliosis in children, we know the number one thing we tend to find, or reason why we find scoliosis, is because some kind of abnormal postural deviation, some type of asymmetry, shoulder asymmetry, rib asymmetry, waist asymmetry, and the scoliosis leads to these uneven or unnatural or asymmetrical body symmetry, which are resulting in postural changes. Normally, we do not expect children to experience any type of pain or any type of discomfort or any type of functional concerns as a result of their scoliosis. So many patients are the abnormal alignment or abnormal posture is not taken seriously because kids are not complaining of any kind of pain. Kids sometimes can have balance or coordination or gait issues as they're going through rapid growth. And because their body is not in the symmetrical alignment, they can have something we call proprioception issues because since they're not in a symmetrical alignment, their body has an uneasiness of where their body is in space relative to other positions. But that's not always the true. So what you want to definitely look for is any type of postural misalignment in children because that's the number one effect. In adult patients, the number one effect of idiopathic scoliosis is pain. Pain tends to occur as the curve progresses in the adult form as a result of compression. And this pain tends to initiate an x-ray or an evaluation, which often brings on a diagnosis of scoliosis. And we call this idiopathic scoliosis in the adult form. Now, some adults never knew they had it, meaning the curve was so small, they were never diagnosed as a child. And then they went into the adult form and they slowly compressed and they had pain develop in the adult form as a result of compression. Other adult patients knew they had it and they knew they had scoliosis, but were not given any type of management treatment options for scoliosis in the adult form. Therefore, the curve progressed in the adult form, now leading to pain. Now, we know the most important thing about scoliosis is that once you learn about it is how you treat it. We know scoliosis does not correct on its own. We know it's more likely going to worsen over time. So therefore, the best time to start treatment when it comes to scoliosis is always now. I have two sayings when it comes to treating scoliosis is that the younger the patient, the smaller the curve, the better the results. And for a majority of patients, we know the curve is never going to be smaller than it is at this moment, that more likely it's going to be larger. And we only can expect one thing is that for you to age over time. So therefore, we want to treat your curve as soon as possible because younger and smaller is over better. Here at the center, our patients benefit from this proactive treatment model because we strive in preserving the spinal's natural integrity and function by avoiding spinal fusion and surgical interventions, which can be very non-functional approaches to the management of scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.